Ketamine treatments can be rapidly effective for patients who are suffering from treatment-resistant depression. However, there is a subset of patients who don't respond. I want to go over 7 reasons why this may be the case. Number 1, medications. The most commonly known medications that decrease the effectiveness of ketamine are lamotrigine and benzodiazepines. So these two can interfere with the effect and decrease its effectiveness. And this could be one reason why. Number 2 is the appropriate dose. You neither want too much or too little ketamine. Think of an upside down U-shaped curve. And the optimal amount is right there at the peak where it's the optimal dose. I like to call it the Goldilocks amount. And at our clinic, we custom tailor each infusion to get that right dose that's going to give you the maximal amount of benefits for each session. Number 3 is preparation. A lot of ketamine treatment clinics don't talk about the importance of preparation. This is crucial. What we feed our minds will play an impact on the ketamine experience. So for example, if one were to watch a horror movie the night before the ketamine session, that's definitely going to impact your experience tremendously. So at our clinic, we recommend patients prepare for at least 5 days prior to the infusion and throughout the series of infusions so that they're in the right mindset for it. Number 4 is the set and the setting. The set refers to the mindset and the intention that one has prior to receiving the ketamine infusions. I like to think of the intention as setting the GPS coordinates before going on a long road trip. And it's really important to know exactly where one wants to go and what one wants to achieve during the session. The other factor is the setting. Where is the clinic at? How do you feel when you're there? What does it smell like? What is the music that's being played? Are you checking social media as you're getting your ketamine infusions? All of these things will play a factor in the ineffable experience of the ketamine treatment. And as you know, ketamine does create these non-ordinary states of consciousness. And you want to be in the right set with the right setting as you receive the IV ketamine treatments. Number 5 is the integration. And what I mean by integration is what happens in between the sessions and after the sessions. I kind of like to think of integration as doing the homework that one knows in their heart that needs to be done. And this may look like quitting alcohol. It might look like starting to exercise. It might look like journaling, meditating, etc. But for each individual person, it's going to be a unique integration. And it could also include talking with a therapist, talking with a coach, talking with an integration specialist to really create the maximal benefits from the ketamine treatments. Although ketamine treatments are great, it's just one part of a holistic approach. Number 6 is the number of sessions. Some people will get dramatically better after 1 or 2 sessions, whereas for other people it can take 4 to 5 to 6 even before they notice a difference. I like to think of plants. When you plant a seed in the ground, it's going to take some time for that to grow and mature. Getting ketamine treatments are not like an on and off switch where all of a sudden it changes. I would say it's more like a gradual process of a plant growing. You wouldn't plant a seed and then come back the next day and expect for it to have sprouted. But if you water it, give it plenty of sunshine, fertilizer, then it'll gradually, slowly grow, much like the neurons and the synaptic connections of the brain. Number 7, we wish that ketamine treatments were 100% effective for 100% of the population, but this is simply not the case. Studies have shown that about 30 to 40% of people are non-responders, and at our clinic we do have a slightly higher rate of improvement, up to 81% of patients, but still, it's not 100%. And we don't know why. And it might be due to individual differences, it might be due to genetic differences, but it is what it is. And so if that is the case, and you fall into one of these 7 categories, don't lose hope. There are many options. Ketamine is simply one tool in the arsenal of mental health. You have other treatments like ECT, transcranial magnetic stimulation, EMDR, different medications that are coming out. And because there's so much research happening right now, this is a crazy amount of innovation happening in mental health. So keep your eyes open, keep your ears open, don't lose hope. Ketamine is an amazing medication, but know that it's not 100% effective, and there might be multiple reasons why this is the case. Thanks so much for watching the video, and I'll catch you next time.